Welcome to the official Spotlight on Procurement podcast. My name is Simon Lipscomb, and thank you very much for listening. For those regular listeners, you'll know normally at this point I give a quick intro to our esteemed guest. I'm going to slightly break that mold today. We're doing something a little bit different, and I think a lot of that intro will get covered in the conversation. For the first time in the best part of, I think, 4 years that we've been running this podcast now, we have a returning guest, and it couldn't be a more perfect person. It's in the shape of Jacqui Rock. So Jacqui, thank you so much for joining us for the conversation again today. Last time we chatted, it was January 2021, believe it or not. You were the commercial director at something called NHS Test and Trace. There was this thing, COVID, going on. And I remember it distinctly as probably somewhere near the height of the madness. I don't know, it probably got a lot madder for you. But I know since then you've had a number of actual big changes on the job front. So probably my first question would be, what have you been up to since we last chatted?
Yeah, hi. Thanks, Simon. And hi to all your listeners. Yeah, January 21. Where's the time gone, right? That's incredible. And I'm absolutely honoured to be one of the first people to be invited back. So I better make this a good discussion so that I get invited back a third time, but hopefully not in another 4 years. So yeah, I mean, as you say, last time we chatted, it was in the height of the sort of the pandemic, test and trace, COVID. It really does seem like a long time ago. And yet when you relive it, it only seems like yesterday as well, especially when it comes to healthcare. And of course, we're still recovering. We're absolutely still recovering. They said it was going to take us at least 10 years to recover. So after we had that conversation, I then went on and sort of took the responsibilities from Test and Trace and set up the UK Health Security Agency, which is now affectionately known as UXA. And, that was really, really exciting because to set up a new health agency, just following on from the pandemic and obviously bringing in organisations like Public Health England, really, really exciting times. And then I was very fortunate to get the position as the Chief Commercial Officer for NHS England and absolutely thrilled to take on that role, part of the ExCo, part of the board, and had a wonderful 3 years or so doing that role, and happy to get into any of the detail, but very proud of what we delivered, especially the central commercial function, which was a commercial centre of excellence that sat in the heart of NHS England and was rolled out across the entire system, all the trusts and the ICBs. And it was during this incredibly busy last sort of 4 years that I've always had a very much of an international viewpoint of healthcare and how healthcare should be commercialised. And part of my role was speaking to many other countries and healthcare systems around the globe. And it was about 2 years ago, I started first talking to the Kingdom of Saudi Arabia. As a result of those conversations and some of the initiatives that we were working on together, I actually made the decision to come over to the Kingdom and work on their Vision 2030 healthcare transformation. So yes, that's where I'm talking to you from today. I'm now based in Riyadh. I came out at the end of the year working for the Saudi healthcare system.
Wow. Okay. There's a lot to cover in a 20-minute podcast in all of that. Maybe, Jacqui, my next question would be, obviously, that whole story is one focused on healthcare. That's a deliberate decision for you? And what is it about healthcare that's kept you focused in that space?
Yeah, good question, because I mean, those of you that might have remembered or know me from the past, actually, historically, my career has been in investment banking. I'm very much a commercial business mind. And then I had a wonderful period of time in the Ministry of Defence in the UK MOD. And so it was the pandemic that first brought me into healthcare, which has always been interesting because when I sit around the table, most people have been in healthcare for 15, 20 years. And, it's vocational, either came up through the clinician route. I sort of landed there in a different way. But the key thing that's kept me in healthcare and the reason I want to stay there is I truly believe it's one of the least sophisticated services commercially, yet it has the greatest opportunity, whether it be in the private or the public sector. Without a doubt, anywhere in the world, healthcare has always got the highest government spend.
Yeah.
Sometimes that can flip-flop between healthcare and defence, but it's usually healthcare and defence. And certainly in the UK, healthcare is the highest spend. And yet there's so much areas where it can be commercialised, the savings opportunity, the speed of clinical innovation that's coming into healthcare right now as we start moving through, we're all getting used to using AI and new medical technology advances. So, one of the reasons I'm here is because it's a really exciting place to be. I mean, I'm talking here as in healthcare. There's so much happening. There's so much change. And at the end of the day, whether it's public or private sector, we all use healthcare. The
Yeah.
NHS still looks after my mother, 87-year-old mother, who incidentally is here in Riyadh on a holiday at
Oh,
87.
brilliant.
So clearly the healthcare system's been doing her a lot of good. I'm very happy to share a picture. She's having a great time. My grandchildren, my entire family, we all use healthcare services. And
Yeah.
it's actually now a very, very personal vocation of mine to ensure that everything that I've learned, everything in my career, I apply it into this industry now to make it the best it can possibly be, both locally in the UK and globally.
Yeah. And Jackie, just to bring that alive, so this is the podcast, very international audience. So I guess Saudi healthcare, how is that structured? Where is it that you're presently working within that system? And if you could maybe a little bit about the aspirations, where the kingdom wants to take healthcare.
Absolutely. And it's very exciting. So I'm sure most people have heard of Vision 2030 because it's very, very public. The Kingdom of Saudi Arabia have done a very, very good job of communicating to the rest of the world its program of diversification from oil. And this is led by the Crown Prince Mohammed bin Salman, MBS, as he's known to the rest of the world. And Saudi is very, very unique in a country. It's graced with quite a few really key natural and cultural treasures. So first of all, it's the heart of the Arabic and Islamic world.
Yeah.
We have Mecca here. It's very much focused. When you look geographically at where we're set as well, we're right in the center of 3 continents, which gives us a lot of influence and a really strong cultural heritage with a community that it's very young, it's very dynamic, it's very focused. It's a very exciting place to be. And so part of Vision 2030 was to unlock the kingdom's full potential. And there's 3 key pillars: to create a vibrant society, to create a thriving economy, and to create a really ambitious nation. And what they did is they moved that program into 6 strategic objectives. And I won't go through all 6 of them. If anyone's really interested, absolutely, but please look up Vision 2030 and you can see everything. And there are big programs within that. Now, people would have heard of NEOM. They would have, it's very famous. We've got big programs like Qiddiya, which is a very, very big sort of entertainment center. Everybody would have witnessed what we're doing around tourism and around sport. You quite often see the boxing here. So there's a lot of programs around that. And of course, we've got the World Cup. We've been very successful at bidding for the World Cup in 2034, I believe. So, but they're not all just about entertainment and sort of sport, etc. There's some real core deliverables and programs which are around the citizens, and one of those is the healthcare sector transformation, and that is what I'm here to lead. So give you the sort of the elevator lift kind of picture on what it is. At the moment, you have the Ministry of Health that sits at the top, and underneath that in the public healthcare system. And I'd just like to say, I think a lot of people didn't realize that Saudi Arabia does have a public healthcare system, very vibrant, 22 million people we serve, out of 300 hospitals, 3,000 clinics, not the size and the scale of the NHS, but it is really, really significant. Yeah. And at the moment that sits under the Ministry of Health. But the aim is that we are diversifying that.
Amazing. I assume, Jackie, part of the reason you went there, but you must have a really interesting perspective, right? You were incredibly senior role within the NHS. You've moved across to Saudi. When you look at that NHS experience and apply it to your present environment, like what do you see as the opportunities for the Saudi healthcare system, and perhaps what do you see as the challenges? Because that seems like a huge, really innovative aspiration, but big, right?
It is indeed, and there's a couple of questions there. So I think all healthcare systems kind of face the same challenges to a certain extent. And the NHS, for example, 76 years old, I believe now. It's a very large organisation, takes a while to move, and radical change can be different. Whereas the healthcare system in KSA and the transformation here is moving at pace. It feels very young. It feels very agile. And the desire to transform things quickly and efficiently is really, really real. But there's always challenges in a healthcare transformation, because at the end of the day, everything you do impacts patients, patient care, patient outcomes. And you're making, I make commercial decisions which, can result in lives being saved or indeed not. So we have to be super conscious at all times of the transformations and the decisions we make, whether that's pharmaceuticals, digital enhancements, equipment, clinical pathways the whole way through. So I think to just answer your question in terms of challenges, they're very similar. They're
Okay.
very similar. There are always different challenges in terms of funding. When you're looking at a public healthcare system, how do you deliver the best healthcare system in the world for the right cost? How do you move at pace? How do you ensure that you keep things alive, innovative? I mean, the pipeline of medtech in the world at the moment is unbelievable. You know, our clinical entrepreneurs every single day are coming up with new ideas and new technology. And that's an
Yeah.
absolute challenge that we're facing in the kingdom as well as we're facing in other countries. And what was the second part of your question? I just sort of mentioned challenges there.
And just, I guess, opportunities as well. Like, to phrase another way, does Saudi have an opportunity because it is younger, because it is earlier in that journey to do things differently, innovatively, to learn, right?
Yeah, I think so. The reason, as I said, you know, I've brought sort of my, I suppose you could say my wisdom over here is sort of knowing how to done it before. It's the lessons learnt.
Yeah.
And when you look at, as I say, I haven't gone into too much detail, when you look at the health transformation, inevitably other countries have been down the path and have tried the sort of the reorganization, tried a lot of the similar things. So I think that's where outside influence coming in to bring those lessons learned, to bring our sort of skill set there, to make sure we don't repeat things that didn't work incredibly well, or indeed on the converse of that is to make sure that things that we've always wanted to do in other healthcare systems and perhaps we've got the ability to do here, whether
Yeah.
that because of funding, whether that because of the, you know, the way that decisions get made really quickly in the
Yeah.
kingdom and in other countries, when you're in a sort of a command and control environment, that absolutely presents opportunity. I mean, I'll just, without sort of going off down a completely different path, but just look at the speed and look at what we executed in the UK during COVID. Actually, not just in the UK, across the entire world,
Yeah.
when healthcare systems went into a command and control. Yes, it was crisis management, and none of
Yeah.
us want to live in crisis, but just the way decisions got made and we moved things forward at pace. When you're in an environment like the Kingdom of Saudi Arabia, which is more in that kind of environment in terms of governance, decision making, it's very, very clear. It's very exciting just how quickly you can move, you can make deals, you can, you know, start to realize your ambitions, your goals, your missions and your visions.
Yeah. And Jacqui, given your kind of your significant experience in healthcare now, like some of the big topics that get mentioned a lot, like you touched on one, medtech, a lot of talk about AI, a lot of talk about data. I'd love to get your perspectives on that and how you're thinking about that as you look at this huge transformation in Saudi.
Yeah. So I think, again, we keep talking about challenges, but I think the challenges of how do we digitalize global healthcare is a very real one for everybody, because it's almost like there's more coming down the path than any of us can keep up with. How do you create an environment that allows you to digitalize the entire system so that all of our data can be shared? We can learn, you know, within a country and within global healthcare systems whilst maintaining patient confidentiality. Yeah, how do we use all of the new digital therapeutics? I mean, you can't probably see me, but I'm picking up my phone right now, and you know, they're turning to their phones,
Yeah.
right? Yeah, we
Yeah.
used to turn to Google, but you know, out here, you know, in the kingdom, we're quite advanced in terms of everything is on my phone, from consultations to my patient records to booking hospital appointments to calling ambulances to to the digital therapeutics that are available.
Yeah.
It's quite eye-opening. But again, how do you keep it enhancing that? I think in terms of pipeline and knowing, you know, how we start bringing things in on a pipeline, because as I've mentioned 2 or 3 times today, there's so many new ideas and new inventions out there. So you've got to bring it back to kind of your mission and your strategy. So for example, in the NHS, we were very clear about our 3 very publicised core visions, and they're very similar here in the kingdom. We
Yeah.
want to move people out of hospital into community, right? More hospital at home. That means more virtual wards. That means more wearables. That means more community hubs. That means giving pharmacies more rights. And all of that has technology around it
Yeah.
to mobilize that. We talk about treating illness. Let's move away from treating illness and let's start treating prevention in our countries. Again, exactly the same here. How do you move to prevention? You educate. How do you educate? On your phone. Gone are the days where we put posters in bus stops, right? But we did used to do that, right? But again, it's all about technology. It's all about digital therapeutics. It's all about using AI to predict, so that as a patient, I can put in my age, my health records, my lifestyle, and how I'm feeling on that day. And there is the technology now. It can start predicting those modelings, and I can start taking real action to prevent myself from getting ill. So we want to move people into that much more healthy living life space. And then again, as I've mentioned, the final core vision which applies here is let's digitalize the entire healthcare system.
Yeah. And Jacqui, I made the question, a lady from Essex originally, now in Riyadh. Has Riyadh been as you expected? Has it been different? Like, what's that been like?
Yeah, really good question. And I mean, I've been coming out here for about 2 years now, and it's an absolutely delightful country to be in, but it's undergone significant change. I think people will know since 2018, the pace of change in terms of, even things like sort of, I'm not going to pull too many out, but, the workforce, the opportunities, for example, for women becoming top chief execs now, you're seeing that everywhere. I think people that may have come to Saudi Arabia maybe 10, 15, 20 years ago, it's a very, very different place now. It's incredibly different. I found it very, very welcoming, very diverse, very inclusive. As I said, it's a very young population. I think I was going to say, I think anywhere I go in the world, actually, people kind of look and think, okay, this is a bit different. So I don't think it matters where I go. I think people always find me a little bit of a character and a little bit of a curiosity. But yeah, it's been very, very, very easy to fit in here and, listen to, respected, and thoroughly enjoy it. And of course, the weather's absolutely fabulous.
Yeah, you definitely got that over London and the UK. Yeah, absolutely right. Jacqui, I'm conscious of time. It's been an absolute privilege to kind of pick up with you again. It's always fun, and the journey's been a fascinating one. I guess my last question is, if we're lucky enough to record another podcast with you in a few more years, like what's next? What's on the horizon for Jacqui?
Yeah, I mean, I'm pretty busy at the moment. Clearly, I've got quite a lot to deliver against and committed to Saudi to get the things that I've been brought over to do delivered. I'm always looking to the future. I'm always looking to and the things that I'm passionate about. So I'll tell you where I'd like to be in 5 years' time. I'd like to be having conversations with you where I can say, as a result of wherever I am and wherever I'm executing, we've managed to turn the dial on global healthcare in these areas by delivering these things. Healthcare we have to embrace technology. We have to embrace AI. We have to embrace how, I'm going to sound very old now, but how the young people of today live their lives. How they live their lives. It's going to be very, very different. Each generation brings with it, there's just my grandchildren. It'd be very rare to probably go to a GP. It's going to be a completely different healthcare system. And so, it's really exciting to be part of that. So if I carry on delivering in whichever capacity over the next 5 years, and I've got some really, really key big things that have come in, and as a result of it, our entire patient experience is different, then I would have achieved my goals.
Jacqui, absolute pleasure to get the update on your story. We look forward to the next chapter in a few more years. But thank you so much for taking the time to talk to me. It's a real
It's been great. Thank you very much.
Thanks, Jacqui. Thanks for listening to today's episode. If you've enjoyed this podcast, please give us a click on the follow button on your chosen podcast platform. We'd also love to hear your views on either future topics or indeed if you've got any thoughts on future guests that we should look to get onto the podcast. Thanks again. See you next time.